For those of you just joining us, I'm Heidi Brenegan, Chief Marketing Officer at AERC. We have 3 other women joining us right now. I'm going to go ahead and let them introduce themselves. Colleen, do you want to start?
Sure. Hi, everyone. I'm Colleen Crockford. I am the social worker at the Animal Emergency and Referral Center.
Bailey?
Hi, I'm Bailey. I'm a CVT at Minnesota Veterinary Hospital.
Awesome. And Kalee?
I'm Kalee. I'm a CVT at Grand Avenue Veterinary Hospital.
Wonderful. Thank you all for joining me today. We are going to have a discussion, and we want this to be interactive. So for those of you who are watching currently, I'm going to have the Q&A box up, and you can make comments as we go and certainly participate as much as you like. We are going to be talking about COVID-19, about veterinary care during this time. We're going to touch on both, kind of helpful tips that clinics have been doing, as well as more conceptual things, and hopefully have a great discussion. And like I said, we want everybody out there to participate as well, so that we all get the most we can from this. So we're going to start off with kind of the obvious question, which is, how do we handle curbside care now that things are starting to turn cold? This has been a concern, and I think most of us were hoping that we would be done with curbside by the time it turned cold. And now, of course, the cases are worse than they ever were before. So I'm going to just open up the floor to all of you and just have you share any tips or tricks that you are doing to make winter curbside care more palatable for both clients as well as your team members.
I can jump in. We actually just had a pretty long involved staff meeting about this with my clinic on the biggest thing for us was, how do we get some of these bigger dogs in and out of the clinic, because we don't have like a super big vestibule to do any handing off without, like, we have back stairs, without these big dogs pulling us through ice and snow and, falling down and that type of thing. And without, having clients congregate in like the front of the door and kind of defeating the purpose of what we're doing curbside. So for us, it was kind of signing, okay, well, we have a ramp, so we're going to say all dog owners have to meet us at the front door. Like, regardless, like, we're not going to do the back stairs or not this with any of these dogs. Like, dog owners just have to meet us at the front door. That's where they'd be coming in normally. So that was, one thing that we came up with to just avoid using back stairs and sidewalks.
Okay, that's awesome. Bailey, do you have any tips on this topic?
Yeah, so I've actually worked at 2 different clinics during this pandemic, and it's kind of different, but similar in a way. So using the vestibule is a really good way to kind of minimize, client contact, and just having the client and the pet in a warm environment while you're, transferring the pet into the hospital. So definitely using that, if you have that, is probably key. And then also really, emphasizing like your word verbiage to have the client. I realized that during this, I've kind of had clients not, really listen to my word verbatim. And so they're getting confused and they're kind of waiting outside instead of coming into the entryway. So really making that clear that they're coming to you inside the building in that entryway, just to make that transfer easier. Definitely it can be a liability if you don't have that and you're meeting, dogs outside and, people slipping and falling on ice. So I really am kind of curious what clinics are doing that don't have that entryway.
Yeah, so if anybody wants to share that in the chat, if you have a clinic that does not have a vestibule or kind of that double door situation, and how you're handling that, that would be awesome to see. Colleen, do you have anything on this topic?
Yeah, sure. So I think one of the things that we're using at AERC that's been new, and we've started it already, is a text system with our clients. And so there's going to be some signage out front that'll say, when you get here, text that you're here, and there's kind of an automated response. So then they've got that sort of written down. They can look back about, here's what I need to do next. And so it alleviates some of the pressure off of the phone system, also helping to keep them in their cars. Also having, signage on the doors and stuff as well, so that if someone doesn't quite follow those directions, they get another reminder, oh, I'm supposed to wait in my car and here's what I do. I think we also got some winter gear for our front team in case there is a situation where they do have to go out, we are also benefiting from that vestibule double door situation. So that's kind of the ideal. But there's going to be things that pop up, you know, an owner that needs help if they're elderly or the dog is big, where they might need some assistance. And so we've provided our front staff with just some basic stuff like gloves and hats and things. Remembering normally our clients always came to us, so they're covered. Hopefully they're bringing their own winter gear with them, but then providing what the team might need for that as well.
Thanks, Colleen. Hey, Emily.
Hi, I am so
Hi.
sorry. I was having some technical difficulties.
No worries. We're so glad you're here. Do you want to quickly
Thank
introduce
you.
yourself?
Absolutely. I'm Emily Waters, and I am the hospital manager at TLC Veterinary Hospital in Oakdale. So been there 10 years.
Perfect. And I don't mean to throw you right into the fire, but we were just chatting about what clinics are doing for their winter curbside care plan. Do you have anything that TLC is doing that you'd like to share?
You know, I think short of repeating, I didn't hear, oh, excuse me. I didn't hear what anybody else said, but we are really trying to figure out how to use our vestibule a little bit better, more efficient. We did have some construction that was fixed at our front where some ice and water seemed to kind of pool. We're still working on it. We're still working on it. It's we're blessed with a really mild season right now.
For sure. It's been really nice to kind of be able to slide into this rather than really get knocked over the head, which is what it looked like was going to happen early on.
Yes.
We have a few comments in the chat. Nicole says they're having clients meet them at the door and then they coordinate when patients are coming in and out. And Dawn says they've been going right to the car and getting the animal. Nicole says any ideas about getting clients to bring cats in carriers. So she must be having a lot of clients who aren't complying. Kalee, you're nodding your head. Have you had that situation?
Well, we had one just yesterday, actually, where like he, you know, literally just kind of got out of the car on Grand Avenue where it was just a busy street in St. Paul. Like, here's my cat. And my assistant was like, you know, not prepared. And so we have been talking about, like, is, you know, your pet secure in a carrier or on a harness or lead, you know, and figuring out how to get that verbiage in. I mean, it seems so obvious to me and to us, right? But apparently it's not. And then the comment is, oh, they didn't want to get in the carrier. Okay, well, we don't want them loose and getting hit by a car on Grand Avenue. So let's figure out how to do this. So just, again, the verbiage that Bailey mentioned, just being really specific and asking questions and figuring out, like, are you in a carrier? Where are you parked? This is where to meet me. And I agree, they're not always listening. So keeping it as direct as you can, and seems obvious, but yeah.
For sure. That's one of the most critical things for patient safety. We had a cat that got lost in AERC's parking lot, and this is pre-COVID, but somebody didn't have it in a carrier and the kitty was never found. It's just so sad when that happens, and it's devastating for absolutely everybody involved. So absolutely a very important safety point. Jennifer shared that they have the handoff right in front of the door. They tell them to meet them when they're ready and to return to the vehicle until we check them out and ask them back to the door. Yeah, and I think, you know, the other thing is when clients have long waits, you know, making sure that as the weather gets colder and less comfortable and maybe they don't want to sit in their car with it running the whole time, you know, giving them that option to go home if the pet's going to be a while. She also added, we have a couple of loaner carriers that they need to come and get from us, that they have to place the cat in and then come to us with the carrier. That's a great idea, having those carriers, so that there's just no way that a cat's gonna get loose on your watch. That's a big one. Any other tips on that topic?
I think for the carrier safety, definitely pre-plan for that. And when you are having your front staff call and confirm the appointments, that you make that a point that we require your pet to be in a carrier for safety. That way you don't have to worry about it, or you probably still will, but you won't have to worry about it the day of as you're about to go get the pet from the car.
Right, good tip. We have another question we're gonna chat about, and people can continue to give their comments about winter curbside care, but I have a little poll that I'm going to launch here, and this will be our next topic here. So if people want to answer, as the pandemic continues to surge and curbside care is still in place, has abuse of your veterinary team by clients increased, decreased, or stayed the same? So I'll give people about 10 more seconds to answer that. A lot of people answering. That's really helpful. Thanks, guys. Give you a few more seconds. We lose Bailey?
Oh,
There you are. We lost you for a sec. Okay, I'm going to end the poll and I'll share the results here. So not too surprising, 63% of you are saying that client abuse has increased. Lucky, almost 10% says that it's decreased. That's wonderful. And about 30% say it stayed the same. What about the people in this group? What are your thoughts on what's happening with clients who might be frustrated and are taking it out on your team?
I would definitely say since the pandemic that I've noticed it's increased. It's definitely a stressful time, not only for us, but the clients as well. So I try to keep that in mind, just knowing that it's difficult or more difficult for them to bring their pet to the vet now, you know, not being able to be with them, worrying about their pet being stressed. And so I feel like with everything going on, clients can definitely tend to take it on the staff for sure.
Yeah. Anybody else want to talk about that?
Yeah, I would agree. We've experienced, you know, quite a bit, and not, you know, we've definitely had flat out abuse. Like I shared with you guys where I was told to F off by a client recently, like in the parking lot, like, and then they pulled out pretty aggressively, and it's like, okay, wow, that went well.
Yeah.
You know, but we're also getting, you know, those clients that have been longtime clients saying things like, you know, 2 months for an appointment. You know, I've been coming here for how long? That's never been an issue. And, you know, that's ridiculous. And just really, you know, the demand from clients kind of in a way that is all on us and all our fault has been quite a I think daily thing that, you know, the techs deal with, and surely like our customer service staff gets a lot of on the phone, and like,
For
what do
sure.
you mean you can't get me in? And it's definitely a real problem.
Yeah. Yeah. And I think even if clients don't get profane about it, they will turn to the guilt strategy. I'm sure you guys
Yes.
are hearing that too. I'm hearing that from our call center staff, that it's, you know, if you can't get into cardiology for 5 weeks, then it's, the response is, so you're going to let my pet die, is what you're saying. You're going to let my pet die. It's like, no, that's not actually what I'm saying at all. But they will try to kind of become emotionally manipulative, which is really difficult to deal with day in and day out. Emily, do you have anything to say on this topic?
Gosh, unfortunately, I have to absolutely mirror what's already been said. And it's unfortunate, but I also feel like this is a time that we can take this experience and learn from it, and help everybody move forward on how things should be run. Yeah, it's we always support our staff, and yeah, I have to mirror it.
Yeah. While we're talking about this, and Kalee mentioned that really demanding client, I don't know how many in the audience have seen the very controversial article by Mark Opperman that was in today's Veterinary Business. I shared it with the panel last night just to make sure they were familiar with it. Mark Opperman has been a veterinary consultant for decades, has been speaking at major conferences for a very long time. He wrote an article called "My Dog Broke His Leg," and proceeded to talk about how he felt slighted because he couldn't get into his regular practice that day, felt that the doctor should have squeezed him in, was directed to go to an emergency practice, felt slighted because the emergency doctor didn't come out to his car and speak to him there, and he had a long wait. And basically, you know, he offered some solutions like Zoom and some audio conferencing solutions, but the bulk of the article was complaining about the care that he felt he was entitled to. And he closed the article by saying he was going to change veterinary clinics. As you can imagine, coming from a veterinary consultant, this went off like a lead balloon. And it's been quite the topic of conversation on NAVC's Facebook page. So let's chat about that for just a minute. I'm sure we could spend all day on it if we did want to, but that's kind of, it speaks to, it kind of speaks to how we've allowed clients to behave, I think, prior to the pandemic, because, you know, in a pre-pandemic world, Mr. Opperman probably would have been accommodated. His veterinarian probably would have squeezed him in. And now we know that that's just not possible. What are your feelings on this, ladies?
I would say just reading the comments from all the veterinary professionals, just seeing, it was just so powerful how everybody felt the same way. Everybody's going through the same things. Everybody stood up for veterinary medicine and they understand what it's like working during the pandemic. It was very shocking that he is a veterinary consultant, not really knowing really how the business is operated and how the veterinary clinics are operating, what they're going through. It was kind of incompassionate and surprising and just very interesting, and I just enjoyed kind of reading the responses and just getting everybody else's point of view on it.
Yeah, I would agree with you, Bailey. The one thing that I thought was good that I mentioned to the other panelists this morning was that for those clinics who are feeling from these clients, getting those same responses from clients and feeling like, oh gosh, and letting that guilt kind of wash over them and feeling like they're not doing a good job because of it. They're getting to see from their peers, nope, we're all feeling this and you're okay. And this person is not in the right in this assessment. And so I'm glad that we're able to help support those clinics that maybe don't have other clinics around them to share that with them. I'm also really hopeful, and Heidi and I have talked about this at length, that this gives us a really great opportunity as we come out of COVID to think about what things do we want to shift or change. And I think we're going to talk about that a little bit more, so I can stop there. But thinking about what things what are we learning that we could maybe do different, you know, and he's a great example of what I would picture as a unruly client, and maybe he's not somebody we'd want as a client moving forward, and how do we shift gears in order to do that?
Yeah, absolutely. And I think it goes back to what we were talking about as regards client abuse. I don't know that he was abusive to anybody, and I don't mean to imply that, but I think it's important that everybody in the veterinary team is on the same page. Like Emily said, that the management is backing up the team members who are on that front line and making sure that they feel taken care of and validated, because nobody deserves to be treated that way.
One thing I found interesting about the article was how he noted in it that, you know, most of my clients' clinics are you know, substantially busier and their numbers are up. But what he failed to realize about that is like, yeah, and sometimes it's short-staffed and it's curbside, and it's like, yes, we've all been extremely busy, and that's great that we're having growth, but it's not necessarily sustainable and healthy way that that we're having this growth and these numbers. So right. I found it interesting that was where his perspective was like, you guys are busy, like do better. And it's like, yeah, we're really busy and it happened really quickly, and we have, you know, sick employees and curbside protocols. And so that was an interesting point to me, that he noted that, but kind of missed the mark on, yeah, we are busy and we're too busy. So I found
right. And thank you for bringing that up, because that hadn't occurred to me. I wonder if, because he's a veterinary consultant who often consults on things to add to your net, if he's looking at that and going, they're making tons of money, they're doing fine.
Right.
So, but it goes beyond that. And there is a point when you have to stop receiving, that it's like, we can't do anymore, and we'd really rather make less money, quite frankly, and have a sanity, right?
Yeah, right. Yeah.
Yeah, I think there was some good comments about, you know, what's the trade-off? Because there's always trade-offs in these things. And the trade-off would be, you know, if we squeeze in your dog, then that means we're paying less attention to another pet. And what if that pet was your pet? Would you forego the quality care of your pet if your pet was in an emergency state versus this pet that's stable, you know, and so kind of like bringing the world view out a little bit more than just this one person. Like,
Right.
there's pieces to the puzzle here, and how would you feel if the roles were reversed?
Right, absolutely. I'm going to bring up another poll. While I'm doing that, we have a question from Amanda that spoke to the curbside care, wanting to know, are people using slip leads on dogs, since so many dogs have leashes, collars, and harnesses that do not fit properly? So that's an important question. I'll let you guys address.
Absolutely. I always have a slip lead in my pocket. Even if I'm just in the vestibule with the pet and the client, I put that on right away just to minimize anything bad from happening, the pet getting away, the pet, you know, running out the door as I'm trying to get it into the clinic. So I think that that's really important. And especially if you're going out to people's cars and getting their pet and bringing them into the building, you should always have a slip lead on every single pet, just in case.
Yeah. Any other thoughts on that?
Agreed. We do the exact same, and it's just another method that we can use to attempt to ensure further safety.
Awesome. I'm going to launch this next poll. So the question is, how far out are you currently booked for preventive and wellness care? Because this speaks to everything that we're talking about. You can get clients in the same week. You're booked out 1 to 2 weeks. You're booked out 3 to 4 weeks, or you're booked out more than 4 weeks. Which sounds just crazy to say, but I know it's incredibly common. You just a few more seconds to vote. Okay, I'm going to share this. Okay. So you can see about half are booked out 1 to 2 weeks, with most of the remainder split between 3 to 4 and 4 weeks. Very few clinics are able to get clients in still the same week that they call, which, you know, I feel like used to be really fairly commonplace. Would you ladies agree?
Yes.
Yeah, I think that it's definitely slowing down a little bit. It's still really busy, and my clinic personally is booking out 1 to 2 weeks, and we are pushing out vaccination appointments and saving, you know, emergency slots for sick pets the day of. But I have noticed that it did go from being booked out 4 weeks, you know, 3 to 4 weeks, to now 1 to 2 weeks. So that's kind of where we sit too.
Yeah, I think that as far as the emergency clinic goes, you know, I've been sharing with people that I've been here a really long time. I've been here for about 17 years. And prior to the start of the pandemic in March, I could count on 2 hands, maybe even 1, the number of times that we had to stop receiving completely. And those were usually because we had a power outage, or we had X-ray wasn't available, we were moving machines or something like that. And once the pandemic was, you know, the shutdown was over, and it was probably May, June, July, we started shutting down, stopping receiving literally every single day. That has dialed back a little bit now. I'm told by our call center that it's more like 3-4 times a week, but it's still happening really, really frequently. Stacy says for their room appointments, they inform the customer to meet them at the front door, and will call them once they're finished looking at their pet with findings and treatment suggestions. But there have been countless times when the owner leaves the premises and just leaves the pet while they run errands, despite being told to wait in the car until the exam is complete. So that puts us behind, as now we have to discharge the patient during another scheduled appointment. Oh, what a frustration. Is anyone else experiencing this, or have any suggestions for compliance? Boy, especially when you're already booked out 4 weeks and then they're taking up appointment slots that you just don't have. Has anybody else had that happen?
Absolutely.
Yes.
You can be
Absolutely.
so clear, you know, please stay in your car. The doctor will contact you, you know, within 10 to 15 minutes. You know, please be available to be reached. Do not leave the parking lot. You call them, they're across the street at Kowalski's, or, you know, they're at Target. And I would say in that instance, then that client can wait to get discharged. You take care of the scheduled appointments, the people that are there on time, following the rules and regulations, you know, and they can wait to get discharged would be my suggestion for that.
Good suggestion. Jennifer says they charge a drop-off fee if they leave as well. So, you know, hit them where it hurts with that one. Kalee, what do you think?
Yeah, I think that one of the issues with us is, well, can I just come back in a half hour? And, you know, we have 2 doctors seeing appointments. We have 4 exam rooms, and surgery patients, like, we fill up pretty quickly. We don't have room to put these patients. It's not even, you know, let alone sometimes, you know, receptionists are holding them, or they're, you know, if they can't be left alone in a room or a cage, or do we have the space? And I think being really clear at drop off, you know, this will take 20 to 30 minutes. I need you to stay put, because as soon as we're done with your pet, we're going to bring them out to the car. We don't have room to keep them hospitalized, you know, literally using the verbiage, we don't have room to keep them here. And I think, you know, in consideration of if you were planning on leaving and you're not going to be back within the time frame of that 20 to 30 minutes or 40 minutes or whatever you're allotting for your curbside appointments, considering like, okay, well, we're going to hospitalize them now. They're in our care. So there will be, a drop off or hospitalization fee. You know, how to implement it, that gets a little tougher, obviously, but I think that's something that we need to consider. And
Anything else to add, Emily?
You know, we're the same, and we just started implementing quote unquote emergency visits. A lot of the times it's a population where they already have an appointment a couple days out, but they feel like it has, you know, exacerbated to a different level. So we are going to be compensated for that. And it does affect, you know, the flow that you currently have when you walk in. The texts come in the morning, the doctors come in, they already think they know what's going on for their day and they plan it out. And then all of a sudden you get the phone calls when the phone's open. So I'm glad that we have implemented that, and so far so good. It's working out. We communicate, the communication part, we're really trying to be very cognizant of that with the clients. And this is a different charge. You know, we will see your pets same day, but it is going to be fit in. We don't know when, and so.
Yeah, I think that offering drop-off appointments to accommodate when you can is probably happening at a lot of practices. I've heard also clinics leaving some emergency spots open in the schedule, giving those to only established clients.
Right.
Are all of you still taking new clients, or have you ceased doing that?
we're taking new clients.
You are, okay.
We are taking new clients.
Okay.
We are also taking new clients, but we do put our clients first.
Yep.
Got it. Somebody said that Tammy says, along with doing same day 6 slots, they've implemented a couple of 6 slots that can't be filled into 1 or 2 days out. So yeah, leaving those until kind of the last minute for those call-ins that day of that dog that desperately needs to be seen. And Amy says that their new clients have to book out, just like you said, Bailey. Tammy's clinic is implementing reservation fees with new clients to reduce no-shows. That's a good idea.
That's a great idea.
I'm guessing, Tammy, you're charging those at the time the appointment is made, because I'm also guessing they'd be very hard to collect on if you didn't. Let's see, let's talk for a minute about bending over backwards for clients. We'll get back to this kind of, we'll call it the Mark Opperman issue. You know, prior to the pandemic, I think everybody in vet med was bending over backwards to get their clients in, and regrettably, we kind of trained them to expect that from us. Certainly human med does not accommodate their patients in the same way. So, you know, do we feel like we've trained our clients maybe to have no patience, no ability to wait, to expect to get in for that wellness exam sooner than 4 weeks from now, which is what they're currently encountering? And what do we think about going forward? You know, how do we do things differently?
So I can start us off with this. I think we've got a really unique opportunity. Change is hard. Nobody likes it. It's difficult. We've been doing it all year. But because we're in a really different state of our business in vet med, we have an opportunity as we come out of COVID to do things differently, to set things up. And so this is a great chance to say, you know, do we want to accommodate every client's wish and dream? What are the wishes and dreams we do want to accommodate? And what are the ones where we want to maybe have some better boundaries around that allows us to have better balance in life and work and home and all of that? It allows us to pee regularly and eat food regularly and go home at a regular time, and support our team in the way that we want to show them that we value them as humans, not just veterinary professionals. And so I think we have a really unique opportunity right now to think about those things as we come out of COVID, because you're not going to get another chance where like you've completely upended your practice in order to accommodate a pandemic. And so now when you go back, we could retrain clients, you know, and there'll be a little bit of groans and grumps, but for the most part, people will, you know, accept the new limitations that you put on them. And that'll become the new normal. And that would be maybe really healthy for all of us to consider. So I'm really excited that this is an opportunity for folks to really do that, look hard at that.
Yeah, absolutely.
Yeah, I think we need to set realistic expectations, and it will take time, but I know we have experienced a lot of, you know, like they get their postcard or, you know, their email reminder that they're coming up due in a month or 2 months and they want to come in right now. It's like, well, actually that was a reminder that you're coming up due next month. So I'm going to schedule you when you're due, not just because you called today. We're not going to get it done 6 weeks early just because you called, you know. And then same on the flip side, if that client is behind 3 months, they probably don't need to be seen this week. They're already 3 months behind. So saying, you know, hey, I'm really sorry that we got behind. My first available appointment is this day and time, you know, kind of just saying like, this is what's available, not saying, well, when do you want to come in? Finding kind of that middle ground of like, I have this day, this time, does that work? And then taking the discussion from there. Instead of just saying, can I come in later today? No. And one of the things that we had talked about, I think when we had met the panelist group, was we had a client call wanting to come in like within a few days for a rabies vaccine, and preferably that day, but was hoping by the end of the week. And we said, oh, I'm sorry, you know, we're new clients, rabies vaccine, we're booking out. I think at this point we were 5 to 6 weeks out. He said, oh, okay, yeah, I get it. And, you know, I guess I'm not that surprised. You're the 15th clinic I called. And we're like, well, what's the problem? Is that, well, I have a grooming appointment on Friday. Well, maybe you need to reschedule your grooming appointment because we can't, clearly 15 clinics you've called can't accommodate you. I'm sorry that you're behind on your rabies, but I think you have to change your grooming appointment.
Right. Shift your priorities.
Right.
I also think it's hard as caregivers and animal lovers. You want to help and save every single thing that you possibly humanly can. And I can't remember if it was an article or a podcast, and Heidi, you can help me out with this because I think you sent it to me, where they said the idea was, not how many pets you can save or help today, but how many pets that you can save or help over the course of your career. Because obviously if you and your team are running yourselves ragged for 5 years, then they're all going to quit. And now we've only helped 5 years worth of pets instead of 20, 30, 40 years worth of pets.
Right.
And I thought that was a really great thing to think about, you know, that if I take care of myself today, which is really hard for caregivers to do, social workers included, we're card carrying members. But if we do that, then we have the capability to do this for the long haul, which is what everybody wants to do. So part of it's changing our mindset about what our values are going to be moving forward.
For sure. Retraining ourselves as much as our clients, quite frankly.
Yep.
Yeah. Anybody have any other thoughts on that topic before we move on, or anybody out in the audience want to make a comment? And we'll take a moment for those before we move to our next topic.
You know, I think oh, I'm sorry, go ahead.
No, go ahead, Emily.
Okay. I think from an operational standpoint too, we can learn from this and change, you know, our system and things like that, knowing that this is going to be the new expectation moving forward and communicating that clearly with clients You know, you send out your first reminder a month ahead of time or whatever, back that up to 2 months, you know, with maybe a little blurb, because it's so easy to miss the communication parts. And, you know, if we can't get them in, we can't get them in. We need to plan better. And so operationally, we need to change that as well on our part.
Absolutely. Kalee?
I was just going to say that part of this pandemic, the struggle has been, for me personally, not being able to, you know, accommodate all of my clients and see every pet and help and fix every pet. But doing that, squeezing, you know, appointments, back-to-back 10-minute appointments, and having, you know, limited staff and biting off more than you can chew, if you will, I'd say definitely contributes to burnout and fatigue.
Yeah, absolutely.
Okay, we're going to move on to talk about any unique adaptations to provide service that your practice is employing. And if you have a comment or a unique adaptation that your clinic is using, we want you to contribute that to the chat, please. So we'll talk first about unique adaptations for clients. Let's focus on client-specific ones, different ways that you're doing business with your clients at this time.
My clinic has decided to help, you know, we all know this curbside appointments take a little bit longer, back and forth phone calls, running in and out. We have come up with email templates for different appointments that our customer service staff is sending out, both when they schedule the appointment and then again, like when they do like their reminder calls. And they're templated emails with whether it's a wellness, you know, the typical questions we'd ask when they come in. What are you eating? Do you have concerns? Do you need preventatives? You know, this type of thing. And, you know, the compliance is a little bit of an issue. Not everybody is doing them, but we are getting quite a few of them back. And it does make that check-in process so much smoother and so much quicker. And I think, you know, I would say probably about half of our appointments, maybe even a little more, do the emails. And it really helps speed things up and streamline the appointments. And when you check in, it's very simple to say, hey, I got your email. Thank you for sending that. Do you have anything that you wanted to add? I see that you needed this. I mean, a 10-minute check-in literally can be brought down to 2 minutes, and it works great.
Anybody else want to share an adaptation?
You know, I think adding the text messaging system is going to be huge, and say, like Colleen was talking about, I would just be curious to see how that would be implementing that. I think that would save a lot of time. And I know myself personally, I have kind of communicated with clients by sending them pictures of their pets, or, you know, just little things like that to keep it kind of more personable, but definitely looking for more suggestions and changes moving forward.
Yeah, along with the text, which is new for us, but so far what I hear from the team is they are really glad to have it. It's a nice tool in the toolbox. We've also done picture updates for clients, which might not be as big for day practices when you're in and out more quickly, but when you've hospitalized a patient, and for us, if they're going to be with us for a few days, obviously the clients can't come back and see their pets, which is really, really hard. And so sending little videos or photos, even through the text system, just being like, here's Fluffy doing great, you know, ate food at, you know, 8 p.m. or whatever. Those things tend to be really appreciated by the clients as well. We've also done on occasion Zoom or FaceTimes with the pets and the parent in the kennel as well, just for those clients who need a little extra support and knowing that their pet's okay.
Absolutely. We have a participant who said they're working remotely full-time, checking pet desk, emails, and voicemails, and they have a history form that they send the owner to fill out as well.
Yeah.
So that's great.
Yeah. We're also doing virtual appointments, which is not something we did before. We're using the Virtual platform. I think the doctors like it. And what we are doing is, you know, when they call, if our customer service team feels it's something that can be handled that way, we schedule it. And there is a fee, and it typically what we tell people is, okay, the fee is this based on, you know, what happens. But if you know, the doctors talk to you and they get the process started and decided, like, we really want to see your pet, then that fee actually goes towards your exam in the clinic. Mm-hmm. So, you know, if the virtual appointment ends up being a history basically for then when we see your pet later that day or the next day. You know, you're not having a double exam fee, or, you know, the virtual fee and the exam fee. It's integrated into the in-clinic exam fee. So our clients have liked that, and a lot of stuff is, oh, refill of ear meds. Okay, yes, we can do that this time without seeing your pet, or, you know, this weird rash and it's just some pigment change, or, you know, I do think it's helpful. It still takes time. We've actually added more positions in the clinic from day to day. We have like an assistant or runner position that basically just helps where needed. A lot of running in and out of pets and checking people out and just being that extra set of hands for all of us. And we've also done a support doctor position when it's feasible. And that doctor literally is not really scheduled with appointments unless we have some overflow, which then the runner will help them with. But that doctor is doing the virtual appointments, the answering of the, you know, the emails and the phone calls that the other doctors literally just can't get to. And they're also help taking some of the back and forth follow-up calls off of our technicians that are just being stretched thin, you know, helping our busy doctors. You know, we are slowly segueing out of that as things are slowing down a little bit, but it is something that has been really just, I can't imagine not having those positions in our clinic with how busy we've been. So obviously not every clinic has that luxury of that staffing, and we don't always have a runner, we don't always have a support doctor, but when we do, it's extremely helpful.
Thank you. I know AERC has had to increase staffing to handle the increased volume of cases as well. Nicole wants to know, are any of the rest of you using a tech service? She wanted to know names of tech services. No, I shared with her that AERC has one called ZipWhip, but that is all I know about it. Tammy says they're calling clients prior to their appointments to collect the full patient history. It's not reduce the workload, but it helps to improve the appointment time. Yeah, I think that's a really good use of time. Okay, so let's talk about unique adaptations that people are employing to support their team, their employed staff. Any tips on those? I know Kalee shared that they've increased the staffing, having a support doctor, a runner to accommodate curbside. Any other things that people are doing?
We've changed our hours actually. We had to with staffing changes. We've actually had 2 new doctors come on this year. They've been great, but obviously, you know, onboarding 2 new doctors during this pandemic has been interesting. But just needing more people, and just we were open 3 nights a week till 8. Now we are just open Monday through Friday, 8 to 6. We've eliminated Saturdays as well. It just wasn't feasible to keep the staff needed to be open till 8 p.m. and to be open on Saturdays. I mean, we do have a few clients here and there who are like, oh, no, you're not open Saturdays, but so many people are working remotely or have, you know, flexibility that so far we haven't had a lot of pushback. And I think it remains to be seen for us if we're going to go back to Saturdays and evenings. I kind of think right now that they're leaning towards not, but we'll see as time moves on what that looks like for our staff and clinic.
So we started, Heidi and I actually run together the pet loss support group at AERC, and obviously we can't meet in person right now, so we moved it to Zoom, which I was a little nervous about, not sure that that would work really well for a grief group, but it's actually turned out to be really helpful for clients who are either further away, don't want to travel, or just want to stay in the comfort of their own home while they're talking about their grief. And then from that, we started a Facebook group for clients who are grieving as well to connect. And so these are things that we hadn't thought about prior to COVID, and we'll probably keep in some way after COVID. So that's kind of neat.
Amy says that they are asking clients to send photos if the client calls with an urgent condition, things like wounds or bumps, lumps and bumps and things like that, just to see if it really needs to be seen and how quickly it needs to be seen. That's a really good tip.
Mm-hmm. We are doing that as well, and I think that it really has helped. Excuse me, a lot for a triage standpoint. I feel like that has really been a good thing. So good for their clinic.
Yeah, well, if virtual can do it, we can do it, right?
Right?
Our chief operations officer also sent a message, said that the texting has also been set up on a few lines here in the hospital to be able to save time with the front to back communication or interdepartmental communication. It's been a game changer for us in that way too. We have a question. Are you planning to provide your runner staff, the people who are going in and out, with winter wear or allow uniform stipends to be used for boots and that kind of thing? What are thoughts on that?
I have heard that clinics are implementing that, or at least going to have like a set, you know, jacket, boots for certain people that are going to be going in and out of the clinics, because as somebody mentioned earlier, there is always that case where there's that elderly person or somebody that has a big dog that needs help, or just, you know, things like that, that you'll need to go outside. So you're going to need to be prepared. And I've heard that some clinics are doing that.
Okay. Yeah, that's all we need is employees slipping on the ice and then not being able to come into work because they're injured. It's just
Right.
terrible.
Yeah, losing more staff.
Yeah, exactly.
We have a uniform allowance, and we order twice yearly. Our clinic has the opportunity to order from, you know, I think we use Land's End is who we use for, and this year there was definitely more of a outdoor gear on the list, opposed to just like the logo sweatshirts and things like that. And I do think, you know, everyone's using their uniform allowance for that. And it is something that, you know, the doctors have talked about on, you know, how we're going to do this. But so many of us do have outdoor clothing that, you know, so far it's just kind of been a discussion, and hey, let us know if you need something unique. And same thing with like different face shields and things like that. If what we have isn't working, please come to us, let us know, we'll order you what you need. So there's just been a lot of that open discussion on, please come to with us with your needs, and let's try to work them out. So.
Right. Emily, did you have any comment on that?
We have had similar discussions as well, and we will be providing for the staff what they need, whether it be a runner or across the board. So.
Okay, great. On the topic of providing for team members, you know, we've already talked about how trying it is when the volume of business is what has been, and it never decreases. What kinds of things are you doing? Our first speaker talked about motivating teams. What kinds of things are you doing to kind of keep morale up, to keep people motivated, those little extra special things that everybody's doing? And again, if you have a contribution from the audience, please make sure to share that with us.
We have just had, I mean, we obviously Tech Week was last month, and we just had a really great show of, you know, great food and different things for all of our staff. And throughout the summer, each doctor in the clinic would bring lunch one day a week. You know, they did a sub bar one week, and you know, soup and salad bar one week, and, you know, set up some social distancing and areas for us to eat. But just literally them saying, hey, I'm bringing, you know, food for you guys this week. Everybody's been working so hard, and just having that time and letting everybody know, like, we all are kind of in this together. You know, we had a discussion at my clinic. We all feel really busy. We all feel really overwhelmed. We all feel stressed, but we are all feeling this. And kind of right now, nobody is busier than anybody else, despite how it might feel in the moment. And just kind of reiterating that we are a team. We're all here with the same end goal. And allowing time off as much as is reasonable during a pandemic, with people out pretty often for COVID symptoms and things like that. But, you know, honoring time off requests whenever possible, and say, oh, hey, we are going to run a little short, you know, a position today because so-and-so really needs a day off, and trying to make that an acceptable thing for the team during all of this, because yeah, we are going to burn out if we don't. So
I agree with what Kalee was saying. Just being appreciated, and, you know, even if it's lunch or, you know, bagels and coffee, or, you know, just saying thank you, and just knowing that you're appreciated for all of your hard work during the pandemic, just, I think, helps and makes all the difference in the world.
Yeah. Amy says that a lot of times when they're really busy, the boss will order lunch. Food is always a wonderful thing.
Especially in the vet field.
Yeah, exactly.
And I would just add to that, I think, especially with the current situation, you know, there's so much that's impacting everybody on all different aspects. This isn't just our work. So remembering that people are experiencing, you know, stuff with their kids and their community and whatnot. And if you can't alleviate the thing at work, you know, you can always ask about, you know, is there something we can do to help you at home? You know, it could be a gift card or a gas card or something like that, those little things can go a long way. Because obviously, if we alleviate a burden in one area, it gives us more ability to have compassion and energy in another. So if you can't alleviate the work burden, you might be able to alleviate a different burden, or just saying, hey, you want to go outside and go for a walk around the block? You know, let's take 10 minutes and do something for ourselves, or let's just find a quiet place and sit and breathe. So just remembering to take care of the whole person. If the specific thing that they're worried about in that moment can't be fixed, you know, we can look at this a little more globally too.
Right, Colleen mapped out some nice little walks around our clinic and how long they take. So when people are like, I have to get out of here or I'm going to go crazy, you know, there's a nice little path, and some of them involve some woods and some nature, which is always rejuvenating. Do you want to talk about the AERC parent Facebook page at all, Colleen?
Oh yeah, great reminder. Thanks, Heidi. So that's the other thing we were looking to do, is to try and find a way to support all our parents with all the changes in schools and everything else. And so we created a Facebook page for our parents, that our team members who are parents, to connect with each other, share ideas, tools, and resources. We drop in anything we learn about in the community, like when they were creating those pods, learning systems, and different ways you could connect or create your own parent group with community members or people from your school. So it's just been a nice way for our parents to get information, also let off steam, share a joke, you know, connect on the parent level, because obviously we're people outside of our clinics too. So that's been, I think, really nice for the parents in our group.
Absolutely. Any other last things on that topic before we move on to what we're doing for pets, which of course is the funnest topic? All right. So what unique adaptations are we making for the animals in our care right now?
I'd say just continuing fear-free, just making it the best possible visit for the pet, you know, spoiling them with treats and TLC, and just trying to make it the least stressed visit as possible.
Yeah, a lot of like the special peanut butter or squeezed cheese, like kind of high reward treats. A lot of who's going to be just sitting down for a while, whether it's at a desk doing charts or, you know, up in the office. Like sometimes those patients that are recovering or just, you know, going to be for a little bit longer appointment, literally, like sometimes they're being held, or they're just, you know, we're getting creative of, okay, we don't have clients coming in out of the front. Can we utilize the rug and this tie for this pet to be here? Because they, you know, they are nervous to go all the way back into the clinic. Can we do the exam in the lobby? I mean, yeah, sure. We're not having clients come in. Why not utilize the lobby? You know, different things like that of what's comfortable for the pet. And just a lot of, like you said, the extra love and time that we have, as little as it is, just to make them feel comfortable, and hopefully get them eating some cheese off the wall or lick mats or whatever it is, to keep them, like, their mind focused on the fact that their owner is not in there with them.
Well, and I think, I feel like Colleen would also echo this. I think that, you know, if you're at your desk and you're holding a pet, that's going to do a lot for your stress level as much as it is the pets. You know, it's working both ways.
Yeah, good for them, good for you.
Right. What about, somebody wants to know if we are leaving animals unattended in exam rooms. That kind of feels like it's probably happening. It maybe shouldn't be, because it can be really risky, but I know that might not be practical either. So what are people's thoughts on that?
That was something I was gonna address. Definitely, I think most clinics are kind of doing that in a way, because it's kind of hard to, if you have a big size pet or a pet that is scared and unwilling to come with you, for you to just grab them and take them with you to go grab a vaccine out of a fridge, or go grab something that you need, go get the invoice, this, that, or the other. So I think a lot of pets are being left in the exam rooms.
Mm-hmm.
Anytime we do it, I try to make sure that they're, eating some canned food or some cheese and try to make it as fast as possible. Or I give the animal, up front to the receptionist and say, hey, can you hold on to this pet? And sometimes, just putting them in a cage so they're confined and they're, safe. What I kind of try to do though is sometimes I'll bring the pet out so that way it can be with the client, as I'm like getting everything together and ready, and then I'll bring that out later. But yeah, what is everybody else's thought on that? Or what's everybody else doing?
Yeah, I mean, obviously at times we don't love it and we try to avoid it, but it's happening. I mean, there are just times when you're busy and the pet is being left there. What we're not doing is leaving that pet that's in a lot of distress alone in the exam room. It's not good for the pet or anybody, right? The cat in room 3 does not want to hear the dog in room 4 nervous and crying and scratching, and like, Bailey said, the fear-free thing too, going back to that of like, what is going to be best for this patient. If we have kennels in the back, sometimes they're better back there being held. We actually had one of our doctors bring in an old backpack baby carrier that her kids have outgrown, and some small dogs actually fit in that pretty well. And so it literally leaves you hands free to kind of bundle up some of these patients, and it's really great for anesthesia recovery or just a smaller nervous pet that wants to be held. All right, here you go, and you're able to kind of go about some of your business.
I love that. That's so funny.
It doesn't work for all patients, but it has come in handy a few times. So
we're innovating. This is awesome.
Yeah, absolutely. I know that technicians at AERC have been doing that for some time. We don't have any baby carriers, but they will often fashion slings out of towels. And one of the technicians, Shannon, who is in the audience today, knows that is how I got one of my dogs, was because Shannon was wearing her. And I was like, oh my God, that's the cutest thing I've ever seen. And I ended up adopting her, so.
Nice work, Shannon.
Yeah, exactly. She's been a great dog, so I have no complaints. Let's see. We have a question about cleaning. Joanne wants to know, is anyone doing a routine wipe down in their practice? At the start of COVID, they would set a timer for every hour to do a wipe down of services, but there have been many days that they're just so busy that it doesn't happen. So wanting to know about these cleaning protocols. Thanks, Joanne, for the great question.
I think everybody's probably slacking in that area a little bit. It's almost like at the beginning of COVID, you were just so on top of it, and now it's kind of falling along by the wayside. I think it is important to clean and disinfect every exam room or area where a pet's been after and before you bring in another pet. I like to delegate that if I can. If you have any kennel assistants or attendants that can help you, clean and just disinfect as much as you possibly can. It's a habit that we should probably continue to do better on.
Yeah, I agree with Bailey. There's definitely been a little lack of attention to detail in some of the cleaning. I mean, I think, our tabletop services are getting wiped off between patients, like the critical things. But yeah, I mean, we did actually have the doctor's daughter and a friend come in and do a deep clean of the clinic last weekend, because I think those things that we were really attentive to for, like, is there food, or, could there be blood on the wall that the owner's sitting there looking at? Like, we're in and out of those exam rooms so much right now with different pets, but the clients aren't sitting there. So I think there are some things in that area that have really slacked a little bit, and it is a conversation that we've been having. And I don't know if any other clinics use Blue Note. It's like a communication program that we use from computer to computer. We actually just set up an alert, whether you do this with text message platform as well, but we set up an alert on our Blue Note platform that, like, you can tag whatever room it is, and it comes up like brown with a funny squishy noise on your screen, and it just says like room 1 dirty, and it just kind of alerts to everybody, like, whoever is free can clean room 1. And that's been helpful. And we've used Blue Note for some time, and I almost chuckled when we did this week. It's like, are we just now thinking about this? I mean, we utilize Blue Note for so much, like, brilliant that we're just now using it for the reminder that, yes, it needs to be clean. But you said delegating and letting people know, yeah, this room is dirty, has been helpful just in this week. And going forward, hopefully sooner than later, clients are going to be back in the building, so we're going to be getting better at this. But yeah.
Any other comments on cleaning? Nicole said with leaving pets alone in a room, they do leave them alone, but they take their leashes off. And so far it's been okay. I think that's, yeah, an incredibly important thing to remember. We don't want those leashes on them or choke collars, God forbid. Nicole wants to know how people are getting new staff because they can't get any certified technicians to apply.
I know, are there CBTs out there not working, looking for work right now? Because I didn't think there were.
Exactly. I think she's responding to the fact that we say we've added team members, and where are they coming from? I'm not the right person to answer that question, Nicole. Maybe if our COO wants to chime in. I know she's watching right now, and she can type in the comments, and I can forward that information along. But no question, it's been challenging, especially since more of the tech schools closed.
We have hired assistants lately. We, probably could use a CBT. I mean, couldn't most practices probably use a CBT that could hit the ground running? But we have been doing assistants that maybe have some background. Maybe they're applying to vet school. Maybe they volunteered at an animal shelter, or, so we've actually been kind of training assistants up, and they're not doing blood and anesthesia things with CBTs, but they are an extra set of hands right now, which is helpful. And we did add an assistant during this pandemic, and I'm not gonna lie, training was a struggle. I like teaching and training, but it became pretty apparent pretty quickly that a CBT probably wasn't going to be able to do a lot of the training, because we are being pulled in so many different, like I have 4 people asking me questions, and I'm expecting this person to just chase me around and keep up. So we had to revamp some training, and I would say that her training wasn't ideal, and we're still working on it. She's great and has a great attitude, so thankfully we're really lucky to have her on our team. But I will say training during this period has not been fun or as adequate as we'd like it to be. So work in progress.
Right.
Kalee, I agree with you on the whole assistant thing. It's nice to have as many bodies as you can in the clinic, but it can become difficult when you're so busy and then the training's lacking. And then not only do you have this person that doesn't know what they're supposed to be doing, or they're not trained, they're not educated, they're not qualified to do certain things, so there's only so much that person can do. But it is nice to have at least somebody try to hold the animal for you, to alleviate that lack of staff.
Mm-hmm. Absolutely. Amanda says they have several vet students that work very part-time for experience while in school, and our COO Jade did respond. She said we implemented a hiring manager, which if you were here earlier in the day, you saw a video of myself chatting with her. Her name's Stephanie Brozo, and she, it's a new position for us. We didn't have that prior. So that's been instrumental for getting people in. She's just very organized about following up with them and the whole process. To have one person responsible for that has been really great. Otherwise, Indeed and Glassdoor have become really popular, and we have the same struggles, she says. So she feels your pain on all of those. Let's go on to what kinds of things are you learning? And this is a totally open-ended question. I have, no specific answer in mind, but what are you learning about your clinic and about vet med and about your clients because of COVID? What are the new things, new realizations that are coming out of this for you? Again,
communication has always been something I think most clinics have, I think every clinic I've been in, and surely at my clinic now, this is a communication issue, or we could do better. Like, communication is a whole nother level of necessary, and working with each other and communicating needs, and just that part alone is, I think, instrumental in just keeping this moving in the right direction. There's so much that we're learning all the time about each other during this. And I think, like I had mentioned before, remembering we are all in this together, and that everybody in your clinic is, even if they're having the not best day, they're doing their best, and we are all kind of running a little a little short and a little tired and a little like the compassion fatigue is getting there. You know, all of these things that we talk about in our industry and have for a long time are peaking right now. So kind of just remember that globally, and communicate as much as possible with your team members based on your needs, or just like what you're doing with patients or clients or whatever, so that, you know, things aren't getting doubled up on, and just try to be an effective team in that sense.
Completely agree with that. Communication is so huge. And right now, I think it's really getting shoved in our face if it's anything less than perfect. So
Yeah.
something that we've done too, that is completely new for my hospital at least, is thinking outside the box. Okay, so doing something unconventional that we've never done before. So we need more staff. So what we're going to do is shorten the doctor's schedules and give them an extra day off. Well, what we just started implementing is that, and we're piloting it with one of the owners, he's coming in on his day off and being a tech. What that speaks to the rest of the staff, you can see it, you know, it's amazing what it speaks to the rest of the team. So again, we're, you know, it's been 4 days, I think, that we've done it, but it's starting to work. And it's a struggle to get to when people are in a habit and in their path that they've done for so many years, do something different. But you know what? It might work. And you just got to jump in and you got to do it. You use the staff that you have. Yes, we could use a ton more staff, but we have staff. Let's use them in an unconventional way.
Yeah.
It's a very innovative idea.
I think being open-minded is huge in all of this.
Mm-hmm.
Absolutely. I think Colleen and I have chatted about this too, that well, even in my personal life, I find myself constantly reminding myself and other members of my family that literally nobody has gone through this before at this scale, you know, and we have to be willing to afford ourselves and others grace while we navigate it, because we don't know what we're doing, but guess what? Nobody does. And I think that the job of vet med looks so different right now. And so everybody who's doing it is trying to figure that out as we go too. And as we spoke about earlier, you know, we're a group of people who's used to being able to make people happy. We're used to being able to give our clients what they want. And so we're not even getting the job satisfaction in that regard, that positive feedback from clients necessarily, because we can't give them what they really want, which is, you know, to come in with their pet or to get in next Tuesday, you know, for wellness care, whatever it may be. And so everything is just very different right now. And I think it's because we're so used to being hard on ourselves, I think it's a daily struggle to just remember to be kind to yourself.
I know we talked about client abuse, but I will say that a lot of clients have been very appreciative and done things like bring donuts or anything, you know, thank you cards, all the thank you cards and letters that we have gotten, just, you know, as for appreciation of us being open and taking care of their pet during this hardship. And I have noticed a lot of clients do realize that, you know, this is difficult and we are busy, and they do see that. And so it's nice to also be appreciated by the clients as well.
For sure, for sure. We've had a lot of really positive reviews come through on Google, and honestly, most of them talk about your COVID process was really smooth or something like that, or I didn't like that I couldn't go in with my pet, but it was handled as well as it could be, you know, considering the current situation. And so there are lots of clients out there who really appreciate the work that we're doing, and I think it's a matter of focusing on that, don't you think, Colleen?
Yeah, absolutely. And there's all the research in the world that, and you've all had the experience, you get one bad thing said to you in the mix of 25 great things and you focus on the one bad thing. It's the one bad grade you got in school. It's the one person who didn't like you that day, instead of focusing on all the good things. It's just how we're naturally wired. And so we have to like actively practice to let those positive things wash over us and really fill up our cup and have more weight than the one negative thing that you get that day, that week, that month. Because as Heidi said, I think in the beginning, especially, everyone was so grateful by and large that we were open. You're just like, oh my gosh, you guys are actually open. We can come there and have our new pet that we just got from the Humane Society taken care of. Right. So, but letting us focus on those things is really important.
Yeah, absolutely. We're running low on time here. So we do have one last question from an attendee that I want to make sure that we address before we wrap up. And that is, Tammy wants to know, are clinics requiring PPE beyond masks? So for example, face shields or goggles or anything like that. What does the panel think about that?
My clinic does require that. We are wearing masks. There are some people in the clinic that, don't feel comfortable with just the mask, so they are using face shields, but it's not something that we've completely implemented at this point. May it be in the future, possibly. And then also with the clients too, we've made notes on the doors and on the curbside parking spots that when they are, transferring the pet, that we do require them to wear a face mask as well.
Yeah, I think we're the same as what Bailey is saying. And then we do allow up to 2 clients in for final care or euthanasia. And then those clients have to be masked and I believe gloved when they come in to ensure everyone's safety as well.
We just recently started to get more safety glasses in and face shields. If you are at like a workstation, for a period of time, you can just do your mask. But if you're going to be up moving in the clinic or you're going to be in like a surgical team with somebody else, those face shields and or glasses now are being required just because of the amount of cases. We've had 2 employees out recently for exposure, and knock on wood, haven't had a positive within the clinic yet, but that does seem like it's, a when and not an if. So the guidelines say everything needs to be taken case by case basis, but that if you do have the 2 barriers, both people, that there's definitely more leeway with, we don't need half of our staff quarantined because there was a positive within the clinic. So, and just keeping in mind for all of us, I hate the mask, but I also want to be at work. We all want to be at work. We want to not be sick. And so just really putting it as, well, yeah, if I wear these glasses and this mask, I'm going to be a little bit hotter. It's a little bit obnoxious, but hopefully when or if somebody tests positive, I can still come to work and we can still be open. So.
Right. AERC is shifting to that as well, to have face shields just for that reason, so that you're not out half your staff when somebody tests positive or has symptoms. Kathleen says the U of M requires a 3-layer mask and face shield or proof goggles. And another participant, Christine, says that they are requiring masks and face shields at a minimum now. So it looks like a lot of places are shifting in that direction.
Yeah.
All right. Any final thoughts, ladies? We've solved all the world's problems, right?
Exactly. We've got this, you guys. We've got this.
I would say my final thought is just to remember, we started at the beginning of the year, we had all of the unknowns in the world, and now there's seeming to be some lights at the end of the tunnel. So it didn't feel like it might end, even though in the back of your head it would, and now we can see that that's coming. And so as much as you can use that to your advantage to hang in a little longer, a little farther, and help your team go that extra mile until we get there, that's like good reminders to have. There's that light at the end of the tunnel.
Vaccine is coming. Right. Thank you everyone for being on the panel today, and thank you to all the attendees for your contributions. It was really valuable. We will include the comments in chat in the proceedings, so you will have other people's comments as well. And again, all of the CE will be available on YouTube as soon as I get it up there.